Is your urine silently screaming symptoms of kidney disease? I'm Dr. Frita. I'm a board-certified kidney doctor, and today I'm giving you 5 warning signs and symptoms on how your urine can reveal dangerous kidney problems. Over 35 million Americans have kidney disease, according to the CDC, yet most don't even know it. 9 out of 10 people with kidney disease have no idea that they have it. This means that by the time their doctors refer them to me for treatment, the patients are in shock. Don't worry. There are ways to stay ahead of the game. There are ways to pick up clues that you might be having kidney disease. One way, of course, is to do preventive checkups, to follow up regularly with your physician. That's very important. But another way is to pay attention to your urine. Yes, your urine can actually give you clues that you have kidney disease. The way that your urine looks, the way it smells, the way it feels coming out of your body, all of these things can give you hints. And so let's talk about it. I'm about to give you 5 warning signs and symptoms on how your urine can reveal dangerous kidney problems. Please be sure to hit that like button and to share this video as we get started. I am Dr. Frita. I'm an MD who has earned multiple board certifications, which means I like to talk a lot about a lot. And I'd like to personally invite you to join me on Mondays at noon Eastern Standard Time right here on YouTube. We do a Medical Monday where I break down all of the hot health topics in the headlines, and I give you a fresh take you won't get anywhere else. I make sense of the stories and I give you evidence-based medicine. And because it's live, you get to interact with me back and forth. You get to ask questions. You get to answer questions. We have a very good time. So please go ahead and grab your lunch every Monday at noon Eastern Standard Time. And let's make Mondays your healthiest day of the week. Let's talk about how your urine can reveal dangerous kidney problems. A lot of times when my patients come to see me because they've been referred because they have kidney disease, the first thing they say is, "Doc, I don't see how I can have kidney disease because I make urine. I make a lot of urine every day." Well, see, that's the problem. Kidney disease is oftentimes silent, meaning that you can pretty much feel fine in many of the cases, and you can definitely keep making urine, even a lot of urine. Meanwhile, that urine that you're making is not getting rid of toxins properly. That's why you have to get your preventive checkups, and most definitely you have to listen to your body and pay attention to your urine. 90% of Americans with kidney disease don't even know they have it. It's not always obvious. Kidney disease can be a silent killer. But let's get ahead of it. Let's just go ahead and talk about it right now here today, because I'm about to give you 5 warning signs and symptoms on how your urine can reveal dangerous kidney problems. Question: did you know that your morning urine color can let you know if you're dehydrated? Let me know in the comments. Number 1, changes in urine color. Okay, so your urine should be a very pale yellow or amber color, okay? It should be pale. If your urine is dark, that could be an issue. Okay, so if you have dark urine, dark yellow, even brown, it could mean a few things. 1, it could mean that you're not hydrated. If you're hydrated well, if you're drinking adequate amounts of water, then your urine is going to be that pale yellow color. So when you look at your urine, if it's dark, the first thing I want you to think is, "Ooh, am I hydrated?" The other thing that a darker urine could mean is infection, okay? If you have a UTI or urinary tract infection, oftentimes the urine will be dark and it will even be cloudy. It often has kind of a foul odor to it as well if you have a urinary tract infection. So yes, dark urine can be giving you that hint as well. And then let's talk about the other colors. What if your urine is brown, like a Coca-Cola color? That could mean that you have blood in the urine. Yes, even if it's not bright red, if it's Coca-Cola colored, that could be a hint that you have glomerulonephritis or an inflammation of the kidney cells. And that's very, very serious. It can mean that you have a post-infectious glomerulonephritis. So let's just say you had a strep throat and then you ended up having a Coca-Cola colored urine. That could be a hint of kidney disease from this color of the urine. It could also mean that you have something called IgA nephropathy. You could have lupus nephritis. You could have any number of problems, but if it's a Coca-Cola color, you definitely need to see your doctor immediately because it could mean that you have some very serious inflammation and kidney disease. Say your urine is red. Well, I mean, that would probably wake you up. That would be a big shocker. But if you have red urine, yes, definitely, it could mean that you have blood, bright red blood. And it's serious because if it's still red when it hits the toilet, you're probably having an active bleed, okay? So it could be bladder disease, or you could be bleeding from the kidneys rapidly, and you could even have cancer of the kidney, renal cell carcinoma. Or you could have something that's happened to a vessel that has caused the vessel to be disturbed or the vessel to burst and you have bleeding. Either way, that's an emergency. You definitely want to contact the emergency medical system. Call 911 if you have bright red blood in the urine. You could also have bright red blood if something is going on in other parts of your urinary tract system, like, again, a bladder infection, a bladder cancer, a tear in your urethra, which is that tube between the bladder and the outside world. Either way, if you have red urine, you need to be concerned. I will say that there are certain foods that can give you red urine, like beets, but you want to make sure that you're safe rather than sorry and check it out with your physician. Another change in the urine color is if it's literally white, like white bubbles, like foam in the urine. Yes, foamy urine could be an indication of kidney disease because it often means that you're leaking out protein in the urine. Now, it's normal to have zero protein or very, very low amounts of protein in the urine. But if you have high amounts of protein, then when you look at the toilet, your urine might bubble up. And I don't mean just a couple of little bubbles when your urine hits the toilet. I mean foamy urine, kind of like if you see those beer commercials and there's a lot of foam on top of the beer as it comes out of the tap. Yeah, I'm talking about some foam that you can't deny. Other things that could potentially change the color of your urine are, the foods that you're eating, like we discussed, also vitamins that you take. But either way, if there's a change, don't just sit at home and guess. Call your physician right away because a change in urine color could be a warning sign that something dangerous is going on with your kidneys. Question: when's the last time you actually looked at your urine color? Was it today? This week? You can't remember? You never even thought about it? Please comment down below. I want to know. Number 2, frequent urination. Yes, I know that might sound counterintuitive because a lot of my kidney patients will come to me and say, how can I have kidney disease when I make a lot of urine? I mean, I go frequently. Well, guess what? Frequent urination can actually be a warning sign that you have kidney problems. So yes, there are lots of things that can account for changes in how frequently you urinate. Your age, your gender, certain things that you drink. So of course, if you have a high fluid intake, you might urinate more frequently. Or if you drink a lot of caffeine, that can make you urinate frequently. Also, certain medications, if you're taking water pills or diuretics, you might urinate more frequently. But frequent urination can also reveal kidney problems. Case in point, if you have a UTI or urinary tract infection, you might develop urinary frequency. You start going more frequently than normal. And normal is considered to be urinating anywhere from 4 to 10 times a day. Yes, that's a big range, but you probably know what's normal for you at this point. But yes, anytime, anywhere between 4 and 10 times a day of urination is considered in general to be within normal range. But if you have a UTI, you may have to keep getting up, going very frequently, more than even the 10 times a day or more than what's normal for you. You might also experience urinary urgency, feeling like gotta go right now, but you get there and you really don't have to urinate. Other things, well, it can mean that there's a problem with the anatomy related to your urinary tract system. If you are a man, for example, and you have nocturia, meaning you're getting up a lot at night, not just 1 or 2 times, but you're getting up frequently, you're urinating frequently at night, that could be a warning sign that you have a big prostate or BPH. So make sure you talk to your doctor, men folks, if you're having nocturia and you're urinating frequently at night. Urinary frequency may also be a warning symptom that you have an overactive bladder, and that can be true for both men and women. It can mean there's an issue with the nerves in the bladder, with the muscles in the bladder. There may also be a central nervous issue, so you definitely want to see your doctor about that. Now here's the surprise. Frequent urination can also be a sign of CKD, chronic kidney disease. Yes, You might be making a lot of urine, more urine than normal, but it could mean that your urine is not concentrated. Your kidneys are not concentrating the urine properly, and that's why you're getting an overflow of urine and urinating frequently. And so again, it may seem counterintuitive, but having frequent urination may actually mean that you're having a decreased urine function. Oh, and another very important thing to know about frequent urination, it could be a sign of diabetes, diabetic nephropathy. We know that there are many warning signs and symptoms of diabetes, but getting up at night, having that nocturia, urinating frequency can be an issue, because if you have diabetes and you have high blood sugar or hyperglycemia, your body's going to try to get rid of that sugar. And when that sugar flows through your kidneys and into your bladder, guess what? It pulls a lot of water with it. And so it can be a warning sign of diabetes. And that's important as related to kidney disease, because diabetes is the #1 cause of kidney disease in America. Be sure to watch my video on the warning signs and symptoms of kidney disease after you finish watching this video. Number 3, pain or burning during urination. Now, you know good and well that pain when you urinate is not normal. So if you've had it and you've gotten used to it, get unused to it and see your doctor, because painful urination can mean a lot of things. Of course, the first thing that jumps to mind is a urinary tract infection, right? If you're having pain or burning in the urine, also called dysuria, you want to see your doctor, have a urinalysis and a urine culture to make sure you don't have some bacteria that's brewing up in there, because that's something that generally is pretty easily treatable. Pain during urination may also signify that you have kidney stones, okay? If you have kidney stones and you have this urine flow that's causing the kidney stone to move, well, that kidney stone might be scraping the inside of your kidney as it moves on down, and this could cause a pain during urination. Classically, kidney stone pain will be in the flanks, okay, in the lower back on the side where the kidney stone is, and it will often radiate or move toward the front to your groin. And if you urinate and these kidney stones are moving, yes, that could cause pain during urination. You could also have pain during urination if you have some obstruction or blockage. Again, for men who have large prostates or BPH or even prostatitis, they may get a pain when they urinate. Also, if you have a blockage, then you might urinate, but you don't completely empty out your bladder. And so you may feel a fullness in the lower front part of your belly or the kind of upper front part of your pelvis. And so obstruction or blockage could lead to pain during urination. I will say that typically chronic kidney disease or CKD is usually painless, okay? You don't necessarily feel pain in your kidneys or pain when you urinate just because your urine function is decreasing. But if you have things like kidney cancer, again, kidney cancer can also be silent. It can be pain-free, but in some cases, a large kidney mass can cause a pain when you urinate. Number 4, swelling or edema. Yes, swelling can be related to changes in your urine in a couple of different ways. Remember how we talked about having foamy urine and how foamy urine can be a sign that you have protein leaking out in the urine? Okay, well, when you leak out protein, specifically albumin, that's a type of protein, that can lead to swelling. And this is how. Your albumin acts like a sponge inside of your blood vessels, right? So it helps to keep fluid and blood inside of the blood vessels where it belongs. But if you have an issue with your urine where you're leaking out protein and you're getting this foamy urine, then guess what? You're losing some of that sponge. And so instead of the fluid staying inside of your blood vessels, it seeps out into your tissues and it causes edema or a swelling. And so yes, that can be related to a change in your urine. Another way is if you have a decreased amount of urine that you're putting out, right? If you've gotten to a point where you have advanced kidney disease and you're not making as much urine, well, that fluid has to go somewhere, and you will usually have the swelling in your feet and your ankles. And if it's more severe swelling, it may go all the way up your legs, in your abdomen or your belly, in your face, around your eyes, causing periorbital edema. So yes, if you have swelling, make sure you really start paying attention to your urine, because a change in your urine might correlate, and definitely you want to consult with your doctor. Another thing that can be related to swelling is high blood pressure, yes. And we know that high blood pressure is the number 2 cause of kidney failure. And if you have high blood pressure, you oftentimes have an abnormal regulation of the salt or sodium in your blood, and you might retain more sodium than you should, and that can lead to a swelling, like a swelling in the feet, a swelling in the ankles. I want you to be sure that you check out my book, Under Pressure, A Guide to Controlling High Blood Pressure. In this book, I discuss, of course, traditional ways to manage high blood pressure, but I also talk about using food as medicine, using lifestyle choices as medicine, using exercise as medicine in lowering your blood pressure, meditation, deep breathing. I give you an integrative approach to lowering your blood pressure. You can order it on my website, dr.frita.com. Number 5, changes in urine volume, of course. If you have advanced kidney disease, then a warning sign could be that you're just not making much urine. You're making much less urine than you normally make. Now, what is normal for how much urine a healthy adult should make in a day? Well, anywhere from 1 or 1.5 liters up to 2 liters of urine per day is considered to be what the average healthy adult will make. If you're making less than 500 milliliters of urine each day, that's considered to be a very small amount of urine, abnormally small, or oliguria. Please consult with your doctor. Other problems that can cause you to make a decreased amount of urine include obstruction or blockage, like from a big prostate, or if you're a woman, if you have a fibroid, that could be causing an obstruction or a blockage in your urinary flow. Also, if you are a pregnant lady, it can go both ways. For most pregnant ladies, and if you've been pregnant, you know, you will have an increased amount of urine that you're making. You also have an increased total body volume. You will make increased urine. But if there's an issue and that little bundle of joy is causing an obstruction or pushing on your bladder to the point where there's a blockage, it could actually cause a decreased amount of urine flow. That's an issue. You talk to your doctor right away. Contact your doctor if you're a pregnant woman and you have a decreased amount of urine volume. Having an increased amount of urine, an increased urine volume, can also signify some kidney disease as well. Remember that if you're having advanced kidney disease and your kidneys are not concentrating your urine properly, that could cause you to have polyuria or a lot of urine. Ooh, there's also something called diabetes insipidus that can cause you to have polyuria. And again, you want to pay attention to what you're putting in your body. There is a such thing as drinking too much water, yes. And if you're drinking too much water, then this could cause you to have an increased urine volume. That's not necessarily a good thing because it can also be associated with hyponatremia or a low sodium in the blood, which could lead to cerebral edema or brain swelling. Be sure to watch my video on the importance of drinking water for kidney health after you finish watching this video. Other things that can cause an increased volume of urine, yes, water pills, diuretics, drinking a lot of caffeine. Ooh, for those of you who drink alcohol, for those of you who have partaken in the spirits, have you noticed that if you drink a lot of alcohol, it can make you urinate more, have increased urine volume? Well, that's because there's something in alcohol that inhibits your ADH, antidiuretic hormone, and that can increase your urine volume. Okay, fun fact. Either way, if you're noticing a change in your urine volume, consult your doctor immediately. So now tell me, is your urine silently screaming signs and symptoms of kidney disease? I hope you found these warning signs and symptoms of how your urine can reveal dangerous kidney problems to be helpful. If so, please be sure to like this video and to share it with the people you care about. Also, if you haven't done so already, please subscribe and hit the notification bell so you'll be among the first to know when I release new content. Having good kidney health is a journey that requires many, many steps and many, many paths. But one of them is paying attention to your body and paying attention to what comes out of your body, including urine. I want you to continue on your health journey and continue on your health journey with me, starting with joining me on these videos and again, joining me on Medical Mondays at noon Eastern Standard Time, right here on YouTube Live. I want you to please continue to do your best to live your healthiest, happiest lives. I'm Dr. Frita.